Extraction of maxillary third molar, maxillary right third molar. First I reflect flap with the periosteal elevator. This tooth is grossly decayed, nothing to hold. So I elevated it. Then after the periosteal elevator, I took this Warwick James elevator, right Warwick James elevator, API, and mesially engaged and pushing from mesial to the distal. A small apical, a small, occlusal level push also on that level. If small segment is fractured, removed it by tweezer, then mesial to the distal using force. Warwick James elevator is best. We can use apexo elevator also. In some cases, apexo elevator is, that is very comfort in some cases, especially some deep cases and all. Small fragments are fractured because tooth was grossly decayed and nothing is hold, and structure above the gingiva all are very very fragile and very weak, so even by small force it gets fractured. Actually maxillary third molars are very easy. Regarding this tooth is very firm and very poor access also. Even the very poor access also, in most of the cases by Warwick James elevator, tooth extracted very easily. This tooth also get mobile very easily, but there is no space, no access, no pathway to take it out. That is the reason. It get mobile very easily, but it is not coming out. There are many reasons, especially that very poor access to that area. Moreover, that even cheek resist it's then when we are pulling, there is some kind of difficulties there. This tooth is mobile very easily. Now I am using this apexo elevator after using Warwick James elevator. Anyway, nothing to fear, thank God. In most of the cases for the maxillary third molar and all, even it has very poor access compared to mandibular third molar. Actually mandibular third molars are very difficult. No, not difficult. It has to remove bones and all. I mean, if it is not coming out very easily, but for the maxillary, there is no thick bone and all. It's just it's very thin bone and cancerous. So no thick cortical plate like mandibular. So we can, by using forceps or by using this elevator alone, this come out very easily. See, very easy. This tool get mobile, but I'm take care of much a lot, because in order to avoid any further complications, and also I'm very slowly taking that. So the tool get mobile very easily, by Warwick James elevator it's enough. But it is not coming out. Look at this. It is mobile, but it is not coming out. That is the reason. Nothing is there to above gingiva to hold by third molar forceps. That is also a problem. If it break by using forceps and all, it will become more difficult. So that I very carefully and taking time and taking it very nicely. Look at this. Warwick James the tooth get mobile much more. Apexo elevator also using in intermittent. It's simple. You can use Warwick and apexo elevator very easily. You can take maxillary third molar in most of the cases. This one is forceps. Now something is there to hold. So very poor access. That's the problem. Yes, it's coming out. Look at this coming out. I afraid of coming integrifation accidentally. If it if it come to the stomach or to the lungs, so I take care of that. That's why I support with the finger and teaser. Okay, thank God it's coming out very well. Look at this, no fracture and all, very easily. Okay, thank God. Thank you so much for watching this video. Please like. Okay.